and welcome to Medulan webinar. The innovation doctor is in Smarts on Fire. A similar titled webinar was done in November 2015 and it has been updated with the changes in the industry. Before we start, I'm Raju Gupta, Director of Technology with Medulan, and I'm here with my colleague Juliet Elart. She's Senior Manager Technology. Today's discussion is focused on will define Smart on Fire and how it works, the challenges and opportunities, and provide a roadmap for getting started. For those of you who haven't worked with us before or heard about us, Medulan is a digital health firm headquartered in Cambridge, Massachusetts. We design and build high-impact health solutions that deliver direct and measurable outcomes for healthcare businesses, providers, innovators, and patients. So Smart on Fire, what is it and how does it work? Before we get into the detail of this thing, let's set up some context. Electronic health records, or EHRs in general, has been in use for a very long time. The original work goes back to mid-1960s. Things keep moving at their own pace, but momentum began to pick up with the High-Tech Act of 2009 when they laid out the meaningful use of health data, and government began to incentivize who uses EHR, and they also laid out the schedule when they will begin to penalize who do not use the EHR. As the incentive began, so was the adoption and the emergence of number of new vendors. Today, there are about 400 or so EHRs in play. About 10 to 15 are the most influential with wide adoption. As the compliance and adoption increased, the intent that the meaningful use was laid out for began to lose its purpose. The focus shifted on capturing the data and complying with the law in terms of technically they were fulfilling all the requirements, but the improved outcome, that purpose was somehow lost. As part of that, the CMS has already announced in January that the way the meaningful use was laid out will change over the course of this year and next year. And they laid out 4 themes, which actually kind of begins to align with what Smart on Fire has been trying to do. So they are moving away from use of technology towards the outcomes. They're allowing doctors to customize the goals around their practices. They want to level the tech playing field with open APIs and to extend the EHR logs, and then interoperability that builds on the different use cases. So let's see, as part of the meaningful use, what type of issues really begin to bubble up and how the new direction will further align with the Smart on Fire type of solution. So as the EHRs are being deployed, the EHRs are designed to do certain core functionality and capture core patient data. If someone wants to use the same data from EHR for some other add-on feature or application, somebody will have to do some kind of an integration work to pull the data out and do either programmatically or import into some other tool and do things out there. Now these EHR evolved by different vendors, so different standards for interfaces began to emerge to get these external apps working. Plus, other problems began to bubble up. Too many players, too many standards, disjointed workflow, and fragmented app discovery. This is the place where Smart on Fire comes to the rescue. So if we really think about EHR is like a platform which has some of the core functionality provided by the developers or the application developer. FHIR, on the other hand, came in picture in 2011, and they were focused on how to interface with the EHR, which is read and write data in a standard fashion. SMART started in 2010 by Harvard Medical School and Boston Children's Hospital, was focused on how to streamline the workflow from EHR to external labs. The SMART and FHIR, they merged in 2014. Now we really step back and look and compare this to what happened in the smartphone market. We can see some analogy out there. Prior to 2007, there were Blackberries and Palm Pilots, and they were great smartphones, great OS, but something very similar to what the EHR provides. But you were confined to the functionality that was provided by the manufacturer. After 2007, when the App Store and the SDK came out, the dynamics and the use of the phone as a device began to change. It was just not a phone, but it really became a tool by which you can do a lot of things. You can extend the functionality. It's just not making a phone call, but can manage a lot of other things. And it streamlined the workflow for users on day-to-day things. If the EHR industry, the healthcare industry, really mobilizes the vision around SMART and FHIR in same way, it can change how the patient data is captured, leveraged, and used. Let's dig deeper how it works. So FHIR, it defines the APIs how to read and write data to an EHR in a standard way. Participating EHR will provide these APIs, which is very helpful to external app developers. FHIR does not worry about authentication and patient context. SMART, on the other hand, defines how EHR can trigger external apps and pass the context of patient data to external apps. We will see the example of this during the second half of this webinar. It also defines the concept of App Store, where the apps can be discovered and made integral part of the workflow. If you merge these two concepts, now you're enabling the third-party developers to extend the capability of EHR in a plug-and-play fashion. The new apps can read and write data to EHR. These new apps become the part of the workflow, and users can easily find what they need. In some regards, a win-win situation. More recently, the SMART and FHIR have laid out the concept, the specification for the hooks, which enables the external apps to listen to certain events, and they can trigger the external functionality without having the users to manually initiate that. At this time, I'm going to pass on to Juliet to share the demo and the other details.
Thanks, Rajiv. Now that you've been introduced to the concepts core to SMART on FHIR, I want to show you an application Medulin created and adapted to SMART on FHIR. Medulin created Prescription IQ to help patients save money on their medications. Given two pieces of information, drug name and insurance plan, the app can optimize costs through a number of techniques, including the use of generic substitution, mail order pharmacies, or even pill splitting. The Prescription IQ tool is a prime candidate for incorporation into an EHR. Standalone, the repeat data entry is a hassle for a clinician. With SMART on FHIR, the physician can interact with the patient's record in the EHR. Let's say Carol. Knowing we need a feature outside of the EHR, we launch the App Store and review the options there. We want to do prescription optimization, so we launch Prescription IQ within the context of Carol Allen. As you can see, the physician has all relevant information for Carol in plain sight: her demographics, current conditions, pre-populated insurance plan, and active prescriptions. In the standalone scenario, the physician has to type in each medication. Here, he has the full context to optimize a particular one: the comorbidities, potential interactions, everything he needs to continue his workflow. We choose to optimize her ProAir prescription. The application works through the potential scenarios to save Carol money, and once complete, we see that she can significantly impact the costs of ProAir through a generic alternative or via a 90-day supply. SMART on FHIR made a useful tool even more powerful by incorporating it into the physician's world and workflow. Now that you've seen our sample application, what else is possible with Smart on FHIR? How are people using it today? What are the limitations? The clearest and most explored opportunity to date is extending the feature set of the EHR. A few examples. HCA, the largest hospital system in the US, partnered with TrialReach to help physicians match patients to clinical trials in their cancer centers. This was all done within the context of the EHR without having to open up a new application. Polyglot, a health literacy platform, extends existing EHR systems with tools and content focused on medication education and adherence. Their first Smart on FHIR integration took 16 hours, with subsequent Epic and Cerner integrations taking 4 hours and 30 minutes respectively. That's the power of standards. The government's new push for value-based reimbursement is likely to fuel a need for targeted and relevant clinical decision support tools in the EHR. Visual DX, a diagnostic tool, has a Smart on FHIR version that, again, adds key value to the EHR without disrupting the physician's workflow. Another health system, Geisinger, spun out an entirely new business, XG Health Solutions, to package and sell apps based on the best practices and innovations they've developed over the last 20 years. They already offer an app focused on rheumatology, with more planned for cardiology, oncology, and physician documentation. Outside of the hospital, FHIR also offers the opportunity for richer patient records through the incorporation of patient-generated data into the EHR. UMC Hackensack partnered with Infor to create a patient-focused app so that patients can send information to their providers before an appointment. And again, don't forget how value-based reimbursement will impact patient data needs. To support the tracking of outcomes, more data will be needed from the patient and other health entities. In the future, with the wide adoption of Smart on FHIR, the technologies can also be used as a tool for public health and clinician education. Ken Mandel, a physician and the chair of the Smart Platforms Advisory Committee, posited that if, prior to the first Dallas Ebola patient, the CDC had published an app to all the emergency departments in the country with proper diagnosing and treatment techniques, the number of people exposed might have been contained. Additionally, the president, in this year's State of the Union address, launched the Precision Medicine Initiative to cure cancer, diabetes, and other diseases. The type of data needed for this effort is rarely integrated within the EHR and very hard to interpret if it is. Smart on FHIR applications can fill that gap and help interpret and coordinate the data moving forward. Companies are taking advantage of the promise of Smart on FHIR, but it's not all rainbows and gumdrops. There are still a number of open issues to be resolved. Meaningful Use 3 mandated the use of APIs, but does not explicitly say FHIR, and it's unclear what mandates will be present in whatever replaces meaningful use. FHIR is still in a pre-release mode and will not officially be released until 2017. Things may still stall as the standards are refined and implemented. We touched on the concept of an app marketplace earlier. In the smartphone world, there are relatively few stores, with dominant players in Apple's App Store and Android's Play Store. Things are not so clear with Smart on FHIR yet. Will the EHR vendors control which apps are available to their users? Will EHR customers be able to curate the apps available to their clinicians? The Health Services Platform Consortium wants to have a completely open app store by 2017, regardless of the EHR. It is not clear which model or models will prevail. Also, think back to Apple's App Store and Android's Play Store. They offer two very different curation and certification models. Apple rigorously checks the applications for vulnerabilities, malicious intent, and bad practices. Android allows just about any app to be published. Android was able to recover from Apple's app Head Start this way, but puts the responsibility onto the user, buyer beware. How will health systems or clinicians know an app is safe, effective, and trustworthy with patient data? What liability is being taken on by using these third-party applications? It all sounds a little scary, but we are building momentum. Across the landscape, EHR vendors, tech industry thought leaders, health systems, and even the government are pushing forward. Duke used its first homegrown Smart on FHIR app in production in October last year. Medicare's Big Blue Button effort is being ported to a FHIR API with sample applications. Things are moving. So which is it? The Gartner Hype Cycle is a classic visualization of the maturity of new technologies. Last time we reviewed the landscape, in November, we saw a number of pundits placing Smart on FHIR right at the top of the peak of inflated expectations. There were lots of ideas, lots of excitement and pizzazz around it. Some companies were going to take actions, many weren't. While other pundits already landed us in the trough of disillusionment. Smart and FHIR weren't anything different than the existing alphabet soup of technologies and would take years and years to become actionable. In the few months since, we've probably fallen deeper into the trough with doubts about health systems' willingness to share their data and suspicions of EHR vendors' motives. Many analysts believe that Smart on FHIR is still 3 to 5 years out. We don't think the situation is so dire. Progress is being made and adoption is happening. We believe that we're somewhere in the middle of it all. The open questions are quite daunting and do place a significant hurdle in front of the technology's wide adoption. However, the early adopters have shown the value of their work and are committed to its success. APIs will happen, but at what pace, we don't know. Big EHRs can play or delay. In delaying, they risk forcing the government to intervene. Vice President Biden explicitly called out the need for improved data sharing as a part of the cancer moonshot. If the government does not see private industry supporting that effort, they may impose regulations that no one wants. The good news is all signs point to play, with both health systems and EHR vendors pledging publicly to improve interoperability. Well, now what? How do you get started? We have a few suggestions. Play around with the technologies. Make use of the examples on the Smart Health IT website and HL7's FHIR site. I'm sure you know technology alone will not guarantee success. You need to talk to your users and stakeholders to make sure your idea matches their needs. As we say here at Medulin, right problem, right solution. A key feature of Smart on FHIR is the integration within the clinician's workflow. Your solution needs to account for that and really optimize the time you have in front of the user. This is a new technology. We still haven't answered the security, privacy, and liability questions. Anything you offer to end users will be examined very thoroughly to ease those concerns. Be prepared to answer those questions. Again, it's a new technology, and we don't have that open marketplace yet. You'll need the help of the EHR vendors to get to the end user, either to understand which users are Smart on FHIR capable, or even through incorporation into their stores. Finally, there's a very active development community around this effort between HL7, Smart Platforms, the Health Services Platform Consortium, and Project Argonaut to highlight the big names. Following their announcements is a good way to keep track of where the space is going. In closing, we want you to walk away from this talk knowing that Smart on FHIR is progressing. And while the road immediately ahead remains rocky, the technology standards are stabilizing, early adopters are moving into production, and investments made today will be leverageable moving forward. Thanks so much for your attention, and if you have any questions we can answer now, please enter them into the webinar question window. Anything we don't get to or didn't cover and you want more information on, feel free to email us and we can schedule further webinars.